My name is Jill Feldman, and I was diagnosed with lung cancer in 2009 at 39 years old. So my story is really different than most people because it started long before I was diagnosed with the disease. When I was 13, I lost two grandparents to the disease within weeks of each other. And then my dad was diagnosed 6 months later with lung cancer. And he died 3 months after that at the age of 41. When I was in my 20s, both my mom and my aunt died of lung cancer.
I'm Luna Okada. I was diagnosed in December of 2012 at the age of 54. I've never had lung symptoms. So the week before I was diagnosed, my family and I were on this incredible trip to climb the Machu Picchu. 2 days after we came back, I had incredible abdominal pain, and I was certain that I had infection from drinking bad water in South America. But it was significant enough, and my husband's a pediatrician, that he decided that I needed to be seen in an ER. From there, we did imaging, and I was found to have advanced cancer.
And I just remember really trying to understand how this happened, that it could not be a coincidence. And so that's really, I think, when I started advocating without even knowing it, by pushing doctors and asking, and finally getting my own doctor to say, you know what? I don't think it's a coincidence. You should get a scan for a baseline and we'll go from there. So I got a baseline scan and the scan was clear. I was 30, everything looked good. I had 4 kids, kind of waited 5 years. And I got a scan and they found a nodule. We were just learning about ground glass nodules more. I got another scan 6 months later, 6 months later, then a year later. Sure enough, ground glass nodule took a nasty turn. That's when I was diagnosed.
This physician was looking at my imaging, he used the words, "We found a lesion in your lung, liver, and bones, and we'd like to admit you so we could figure out where the origin of these tumors are." And I was listening, and finally I was like, time out. Are you telling me that I have cancer? And he said yes. And I was stunned. I actually couldn't believe it because I was such a low risk person for lung cancer. I had no risk factors. Back then, I was ignorant enough to not realize that people who never smoked could even get lung cancer.
All I could think about was I literally was diagnosed with the same disease that I watched kill my mom and my dad. Like, I still get emotional when I think about it, because those were the two most difficult, worst times of my life, right? The only thing worse than, I think, for a lot of people being diagnosed with cancer and the fear that you live with is watching the people you love suffer and the fear in their eyes because of your diagnosis. I could almost feel it because I could totally identify with it. Then I thought, okay, I'm going to be the story of hope. I'm going to be the poster child for early detection.
So the next steps were do a biopsy, because at the time in 2012 and early 2013, they had just started testing for biomarkers, for tumor markers. At the time, there were 2 gene mutations that were treatable with an oral chemotherapy, but I came back negative. Started a traditional chemotherapy. And then when we did follow-up imaging, I had disease progression. It wasn't helping me at all. And that's when my doctor suggested that I get tested for this newly described gene mutation called NROS1. Accounted at the time for, they thought, 1% of people with adenocarcinoma of the lung. And in my head, because I do work with a lot of statistics in my business, I thought, okay, that means 99% chance I'm not going to have this. My husband and my oncologist talked me into it because they said, if you have it, there's a oral chemotherapy for it. Good news is that I was able to get this biopsy. They sent it out. I was positive for ROS1. We wrangled with our insurance company, but as soon as we got that, I started this medication called crizotinib. Been on it for almost 12 years now, and it's controlled my cancer. And I've responded really well to this medication, and I'm amongst a handful of people that are getting really long duration on this oral chemotherapy.
So I got the testing done and I was EGFR positive. It actually guided my treatment from there because adjuvant therapy for lung cancer at the time had very minimal benefit. I needed to be able to look my kids in the eyes and know I did everything in my power. I look at adjuvant therapy or therapy after surgery as almost like insurance, right? And so I needed to do it. I had a discussion with my doctor and I ended up going on a targeted therapy. For me, the greatest impact is my dad died 3 months after he was diagnosed, just a few weeks before I graduated 8th grade. My mom died 6 months after she was diagnosed, just, 6 months before the birth of my daughter. But because of advancements in research and treatments, I have lived 15 years. I've celebrated moments and milestones with my family. Those are the treasured milestones that were stolen from my parents and me because they didn't have the treatment options that are out there now. The true value of all this research for patients and families is hope. Hope represents a chance, and every patient deserves a chance.
There are a lot of people that have asked me, do you ever wonder why you? And I guess I take that and flip that a little bit. And I always wonder, why not me? I never took it personally. It's better for me too, because I think there's so much stigma surrounding smokers. Even if I did smoke, I don't deserve lung cancer.